The State Department of Public Health today reporting another spike in cases amid the ongoing measles outbreak taking place in the upstate.
The rapid spread drawing national attention. News News' Emma Charles joins us live in the studio. And Emma, you had a chance to speak with doctors about what people know and why this increase is so alarming.
That's right, Carolyn Brendan. Today, the South Carolina Department of Health announced 15 new cases since Tuesday, bringing that total up to 126 in the state, with 11 schools exposed. Now, with all the holiday travel coming up, the outbreak is drawing concern from across the country.
We do know that people will continue to travel for Christmas and that there will be family gatherings. So those are, again, potential opportunities for additional exposures to people outside of your normal household setting.
Right now, 303 people are in quarantine in the upstate. Measles is a highly contagious and potentially life-threatening disease that many people are vaccinated against in early childhood. But experts say the current outbreak, concentrated in Greenville and Spartanburg, comes from low vaccination rates, especially among children.
It goes very quickly from person to person. And when you're unvaccinated, you don't really have anything to protect you from the infection.
Dr. Annie Andrews, a pediatrician who is running for Lindsey Graham's U.S. Senate seat, says it's important for people to realize how easily measles spreads.
What is so distressing to me about this current measles outbreak is measles is highly, highly contagious. That's one of the reasons scientists developed a vaccine to combat measles, because it is so infectious, far more infectious than the flu or COVID.
Doctors say while measles has symptoms that have similarities to a common cold, measles can be much worse. 1 in 5 patients with measles are hospitalized, 1 in 20 can get pneumonia, and 1 in 1,000 can get encephalitis, which causes swelling in the brain, leading to possible brain damage. The Department of Health and doctors say if you feel sick, you should stay home. And they're reminding patients who may be hesitant about the vaccine that it's safe, and the consequences of not getting it could be much worse.
And as a parent with a small child, it's hard when you take them into the doctor, even though you know it's good for them. We know that the risk of getting measles is much higher than any potential risk of the vaccine. Studies have been done that have proven time after time that the MMR is a very safe and effective vaccine.
And if you want to check if you have received the measles vaccine, you can check by contacting the South Carolina Department of Health and Environmental Control. People born before 1957 are considered to have immunity, and those born between 1963 and 1967 should check if they were revaccinated, because they were issued a vaccine during that time that didn't work very well. In studio, I'm Emma Charles. Count on 2.